Healthcare Reform in Two States by Amanda Inman. Rasmussen Healthcare System is looking to expand from their original footprint in state of Illinois to move to Ohio. Not to move, to expand to Ohio. In this presentation, we're going to discuss some healthcare reforms in both states and whether or not that is a good decision for this company, Rasmussen Healthcare System. First, I want to discuss the Affordable Care Act, ACA. Obama passed Affordable Care Act, also referred to as Obamacare, on March 23, 2010. The overall provisions of the Affordable Care Act were extended to cover millions of Americans that did not have health insurance. Also to lower the existing healthcare costs and overall improve the American healthcare insurance industry as a whole. The Affordable Care Act as well is putting a financial burden on a lot of states. Without serious Medicaid reforms and healthcare reforms, spending will continue to compromise other programs that help the needy, which has been compromised since Obama passed the ACA in 2010. Let's talk some numbers, put it in a bigger picture. In 2017, Illinois' budget, about $8.2 billion to cover healthcare costs out of their $32.1 billion in revenues back in 2017. For Ohio, they spent $2.4 billion spent on healthcare out of their $65.1 billion in revenue. This total is about 25% of these two states' budgets that is being spent on healthcare, the Affordable Care Act, and it's all for needy, low, or lower income people. As I mentioned in the previous slide, if we do not control this spending through healthcare reforms, the amount we're spending is going to compromise a lot the other government-funded programs that they offer. So let's discuss Illinois. Bruce Rauner is the governor of Illinois. As for Illinois, almost 1.3 million of Illinois residents qualify for the Affordable Care Act. Illinois is a Democratic state, which means for Illinois being a Democratic state, they are for the Affordable Care Act and helping Americans who currently do not have health insurance. And what else that it affects. So we are for, being a resident of Illinois, we are for the Affordable Care Act. The numbers do show that. Medicaid is a state-federal partnership originally meant to be a healthcare safety net for the poor and low-income families, but now it is becoming the most common healthcare coverage to more than a quarter of Illinois' population. It's no longer just a safety net. It is the way healthcare is turning into, and Illinois likes it like that. Illinois does not see a problem that they have to compromise other state-funded programs for this sole reason, because they are spending too much on the Affordable Care Act. In 2000, just 1.37 million people, or about 11% of our population, was enrolled in Medicaid. Today, in 2018, the number has increased 135% of enrollment for Illinois residents, about 3.22 million people. It's mind-blowing. Now let's discuss Ohio. John Kirsch is the governor of Ohio recently. As of March 2016, more than 1.8 million of Ohio residents have been approved for healthcare coverage under the Affordable Care Act. Ohio is a Republican state, so let's discuss what that means. Ohio, being a Republican state, does not agree with the Affordable Care Act. I will go into that a little bit more. They think it's costing way too much money, and it's compromising a lot of the other aspects of the state funding. Ohio has been known for their well advertisement and their bold healthcare incentives that they do offer their residents. They recently just passed these. It is known that Ohio, their lawmakers have had enough. They do not agree with the Affordable Care Act and Obamacare. Ohio's ultimate goal is to reduce these costs and put it into a more of affordable private coverage. So offer more, make it more competitive, giving them incentives to obtain private health care coverage rather than going through the state funded programs. Giving some of these residents a savings account, they earn rewards, just bracing them to live a healthier lifestyle. So conclusion is, do we recommend Rasmussen Healthcare Systems should expand to Ohio? I think absolutely. I think that is the way our healthcare is going, a more private healthcare insurance. There's more money involved when it comes to that than the state funding. They're encouraging people to be healthier, giving all those incentives to Ohio. Ultimately, it's you're expanding the business, you're expanding the resources, you're getting more people, which ultimately you're making more money for the company. I do not think it's a bad idea. I think Ohio is a good place. We get to learn new things and ultimately, as I mentioned, expand their market. So thank you so much.